Hey everyone, welcome back. My name's Gus, I'm a cosmetic and implant dentist. Today I want to show you a case that I've been kind of treating or maintaining for a number of years now. Okay, so it's an all-on-4 case. This is the case here. And I don't really have before photos because I didn't do the implants. The implants were done a very long time ago, probably 10-15 years ago. In Italy, and that's where this patient originally he came from, and he lives out there. The implants have lasted. They're Nobel Biocare implants. Okay, so it's a good reputable brand of dental implants, and the bridge work, i.e. the teeth that we can see here, these are zirconia teeth. Okay, so if you watch my other videos, zirconia is probably the strongest material. There's a number of advantages of using zirconia, but I would say this overall treatment is not ideal. I feel it could have been done better, but the main thing is it has lasted all of these years. Okay, he's had 10-15 years out of it at least, and it's still fine-ish. It requires a little bit of maintenance. Now let's compare this side by side with a bridge that typically we would give to our patients. So there's a number of differences I want you to see here. So the first thing I want you to notice is the fit surface. Okay, the fit surface of this is the surface which fits against the gum. Now, a typical bridge which we do is kind of highly polished here, and I typically use a metal bar in my zirconia bridges. Okay, and it's the metal that touches the gum. Although zirconia is a really what we call biocompatible material, okay, and biocompatible means it causes very little irritation. The same is true with titanium as well, okay, so it doesn't really matter whether you have titanium or zirconia. So the bridges that we do typically have the metal against the gum, and in this case we had zirconia. Now zirconia against the gum is really healthy, but this isn't so healthy, okay, for a number of reasons. First of all, it's concaved. Okay, what that means is it's got this kind of curved surface sitting against the gum. So if this was the gum, the bridge is almost sitting like this. Okay, it's not that dramatic. We've seen far worse cases done abroad, and this is not too terrible. However, it is a rough surface, and I don't know why it's rough actually, but it's always been rough, and the fact that it's rough makes it impossible to clean. It harbors bacteria, and this is the big problem with this case. Now, if you look at the implants, you can see that some of them are kind of showing more than others, okay? And it's not the implant you're seeing, it's the abutment, but let's face it, that's a bit of a technicality. We should ideally have gum pretty much all the way up. Okay, there are certain situations where we can expose a lot of metalwork, okay, but this isn't deliberate in this case. And what this means is I have to see this patient every few months. We take everything off, we give the implants a clean and a jet polish, and we give the bridge a clean and a polish as well, and then we put everything back, okay? This guy doesn't really matter too much. He lives kind of close, he's not working. So apart from the cost, it's not a massive inconvenience on his life. But if you are working and you live far away from the place where you had the treatment done, this is a day out of your life every two months. A month. There's been periods of times where I see him every single month. Now, the next thing I want you to kind of pay attention to here is the spread of the implants. Okay, can you see? It almost looks like all the implants are in a straight line. Okay, now this is a problem because when we are designing all-on-4 or when we're doing a full set of implants, we want to create what's called an AP spread. Okay, and what this means is AP stands for anterior and posterior. Okay, so you want to spread the implants out in front to back fashion as much as you can. This creates stability of the bridge, and it puts less stress on the components like the abutments. Okay, if you imagine like a chair on 4 legs, okay, the legs are all spread out widely, and that gives you more stability. If they were all in a straight line, that chair would be pretty unstable. So think of it like that. So it's a similar kind of principle. Now, I think the reason it's not caused any issue, well, very few issues. We've had a couple of abutment which needed replacement because screws broke. Maybe it's related to this, okay, but I think the main reason we've got away with it is in the opposing arch. So what we're seeing here, this is the patient's lower set of teeth. For his upper set of teeth, it's a removable denture. And he kind of needs all-on-4 or something at the top as well, but he's kind of happy with how he is. So the goal is for our patients to be happy. Because he's got this denture which is kind of moving a little bit, it's absorbing forces, he's not really able to put a lot of force on these lower teeth and implants, and I think that's why we haven't really had any problems. If we had a normal all-on-4 at the top, then I think this would be much bigger of a problem, and we'd see more issues, more problems with the abutments because we don't have this AP spread. Now, the way that we get this AP spread for patients is by putting the back implants as far back as possible and even angulating the implants, you know, to try and exaggerate this the difference. To be honest, it's more of a problem at the top than the bottom. Sometimes we can place implants really far back in the pterygoid region. Okay, again, that lets us spread this load from front to back a bit more efficiently. Now, in this case, it's not a complete disaster because although the implants have kind of been placed in the straight line, the angulation of them is slightly different. Okay, so if I kind of do this on my hand and I try and show you, everything's in a straight line if you're looking at all the implants from the side, but it's not actually like that because the front two implants are angled in a slightly different way and the back two implants are angled slightly different. So although at one point they all look the same, at the top we do have a bit more of a spread. But if I'm being really critical, you know, that's it's not the most ideal kind of placement of the implants. These days, I personally do almost every all-on-4 case guided, okay? Even though it's not necessary, I kind of like to do that because I feel a little bit more secure that the implants are predictably in a better position. So I think the point of this video is that if you've had all-on-4, and we're seeing loads of people who have this work done abroad, and it's not done in an ideal fashion. It's not a complete disaster. Often, you know, you can have good cleaning done every couple of months or so, and you'll be able to maintain the bridge. Okay, there's a lot of expense involved in redoing a bridge, redoing implants, taking implants out, redoing them, and it's probably a procedure you don't want to have to go through unless you absolutely need to. If you've got somebody local who's comfortable taking the bridge off, giving it a good clean, and I would recommend an air polish on the implants, okay, and some therapists will do this, and be sure that it's the polish they're using is suitable for dental implants. Okay, there is another one which is more aggressive, which is great for getting staining from in between the teeth, but for the implants it needs to be something which is going to dissolve. All the little bits which are left over need to be able to dissolve, and it's a bit of a gentler clean as well. So maintenance is key with these things. For our patients, for bridges which have been placed and I'm kind of happy with the positioning and the cleanability, we'll see people 1 year later, and usually at annual intervals. And I mean, these are photos of people who we've seen a year after with a PMMA bridge, and everything looks like it was done yesterday. Okay, yes, we needed to clean them up a little bit. There's a bit of hard tartar buildup, but the gums look healthy. Everything looks really healthy. So there are a lot of excellent clinicians out there, excellent surgeons who will be able to provide you with this treatment, and they're thinking about the long-term cleanability of these bridges. But if you're in the unfortunate situation and you know it's a little bit difficult to clean underneath there, you might need to see your hygienist, therapist, or dentist who can take the bridge off, do the cleaning, and put it back a little bit more often. Okay guys, I hope you got something out of it. You know, please do remember to hit the like button, you know, click subscribe. It helps these messages reach a wider audience. And these messages are really there to help educate people who are in this kind of situation, because there's not a crazy amount of content out there which isn't too salesy. Okay, and I hope this wasn't. All right guys, take care.